Good morning, everyone. It's a pleasure for me to be here introducing Dr. Bahija Jallal as our keynote speaker today. Dr. Jallal earned her Ph.D. in physiology in the University of Paris, and then she moved to Germany as postdoctoral fellow in molecular biology and oncology at the Max Planck Institute for Biochemistry. Immediately after, she transitioned to industry as a scientist, launching her career at Sushen Inc., a biotech company that was located in San Francisco. More recently, Dr. Jallal, as the president of MedImmune, steered 5 drugs into FDA approval, including their checkpoint inhibitor Imfinzi for the treatment of unresectable urothelial carcinoma and non-small cell lung cancer that had no further treatment. She is currently the CEO and the director of the board of Immunocore, a company that focuses on an innovative T-cell receptor-based therapy that has the potential to transform the life of people with serious diseases. With more than 20 years of experience in industry, she has authored over 70 peer-reviewed publications, more than 15 patents, overseen R&D, and acted as member of the board of multiple companies. In addition to her role as a leader in a global biotech, she is also a voice of diversity and inclusion in science. She is the immediate past president of the Association of Women in Science, and her commitment for empowering women in science is really admirable. She also has shown the world how diversity fosters a company's growth and success by having 50-50 men to women employees ratios and with an executive board equally as diverse. I love her phrase that says that innovation happens when there is diversity of thought. And among other many awards and recognitions, Dr. Jallal has recently named the 2017 Woman of the Year by the Healthcare Businesswoman Association. Without further delay, from UK today, and by video conference, Dr. Jallal is going to drive us in an amazing trip from the bench to the boardroom to help us discover a world of possibilities that we can hopefully implement at work back in Monday. So please join me in welcoming Dr. Bahija Jallal.
Good morning, everyone. So I apologize for not being there. I would have loved to be in Florida with all of you. But at least thanks to technology, we're going to try to make it work. So I'm going to try to talk not too long because I would love to have questions from you and hopefully we can have a dialogue. So I thought to structure my talk is really just to share with you not my bio again, but mostly the learning across my own journey and what I've done, but most importantly really the lessons learned, and hopefully you can either learn from it or at least get your attention to ask some questions. And then after that, I would like to just try to really open your minds on the exciting era that you are actually part of, and hopefully try to get you to think about the ecosystem much, much larger than I've ever thought about when I was in your position. So if we go to the first slide, I think there was the from the bench to the boardroom. I thought that's where I would be. So I was thinking in my head, a few years ago I was in your shoes, but actually it's many, many years ago, so that doesn't get me to feel very young right now. I always say that my journey has been everything but a straight line, right? So there are all the turns, and I think when you're my age now, I'm going to age myself today, you can turn around and really see that what you saw as difficulties and what you saw as failures sometimes are fantastic learning So let me just walk you through that journey on the lessons learned. Like I said, many years ago, I was sitting in your shoes there. I had done my master's in University of Paris. And my PhD the same way, and then moved to Munich to do my postdoc. And actually, I had a position in Morocco to go back and teach at the university, but then I thought I really need that postdoc experience to see, can I do it, and what's research means even more than being a PhD. So really where you are today. And then after that, where you're sitting today is where I was with the same thoughts. Should I go to academia? Should I go somewhere else? I actually, when I was, and the view there was from Europe, which was completely different than in the US. In Europe, there were mostly big companies, pharmaceutical companies, the Mercks of the world, KGA and Boehringer and things like that. There were almost none, no real biotech there. So for me, when I was contemplating what to do, it was what we all hear sometimes and learn, that basically any other venue than academia, it will be just basically a failure or abandoning science. That's really how I looked at it at that time. And especially being in Europe, it was, there is nothing to do other than staying in academia and try to get this, the competition in that very, very, very few positions that are tenured or not. But it was that kind of choice. Am I going to be abandoning science and go to a company, or I will, stay? So it so happened that I did the halfway, something that you don't have to decide. I took my PhD students. We had the opportunity to go to California with my husband at that time. He went to Stanford, and I took my PhD students and was at the company Sugen. If we go to the next one, Sugen was a biotech company that my postdoc advisor had started, and it was a perfect spot not to make a decision. So I took my PhD students with me, and I said, I'm going to be just in the company physically, but I won't work for the company. And I had my grant, and I was going to continue doing that, because I had a complete bias that you have to abandon science if you're going to go to company. All they do is screen compounds and things like that. How difficult could that be? So obviously I was wrong, but I had, it's like every scientist, you need to have the data, you need to experiment for yourself to really find out. So at Sugen, it was really, they were housing me and I was observing. And it was one single day, and I can absolutely remember vividly that day, where a patient came, wanted to thank, the scientist, because she was still alive with the colon cancer and could, be with her grandkids and things like that. And walking out from that room is where I absolutely felt, it might sound cliche, but it's the truth. Walking out from that room, that I decided this is exactly what I want to do. But I want to do it on my own terms. I want to do it doing a great science, never abandoning science. I will do it with great science, but I want my science to have a purpose. I want my science, to be used to help patients. So I found my calling, if you will, at that time. And then I switched actually to Sugen, started working for the company. And I always say the learning there is that we failed twice. We had 2 first compounds where we completely failed. And then we stopped the company for 2 weeks doing lessons learned. what could we learn, from these failures that the next compound could be successful. And that was, when I look back, I always say to my scientists now and folks in the company, this was the best thing that happened to me, that I was associated with the company where we failed twice, right at the beginning of my career, because I learned so much during that time. The third time is a charm. Obviously, we get a compound that's helping patients as we speak, either in renal cancer and in colon cancer. But really, Susan taught me a lot of things. That first of all, Susan was like a united nation. There was a huge diversity. I was also mistaken there because I thought every company is the same. They will have, of course, there is no problem with diversity. And I saw the power of diversity and what it did on the diversity of thought altogether. And so I won't talk about it today, but that's, obviously didn't materialize when you go to other companies, that you see the world is very, very different. And so my other passion that started is really how can we advocate for diversity of thought, because I link it very, very closely to innovation and to science. And if we don't have that, we lose that innovation. So from Sujan, I won't get into the details of what happens. This is what happens in companies. They close, they do, and all the stuff. But these 9 years were like the best, or I thought at that time the best in my career. And then moved to Chiron. Again, I'm coming from this very diverse company, thinking the world is like that. But then, I was, my mission there was to do a translational medicine. It was not called even that way at that time, but I knew I was in oncology, but I wanted to do something. What I learned at Sujan, I was, in my title before you could not see translational, but I knew it was a new area for me, a new area for the company, and I really wanted to do that. And I think I'm saying that to you because, don't just look at what you have done, to look for what you're going to do after. Is you can actually just apply your learning, and every position you go to, every job you go to, you have to seek also to learn something, which is, I think, is the best jobs you can have. So Chiron, I didn't stay there very long, and the reasons are, but it was 2 years, or a little bit over 2 years. We did develop the whole, trying to really transform Chiron from what we call the University of Chiron into actually bringing, a good science into developing medicine. And that side of things was fantastic. The other side was, that was my first encounter with lack of diversity and what it can do. Right, was literally, I was the only woman in that executive team. It was a very challenging situation from that aspect. The science was great, but from everything else, it was a little bit more challenging. And that's my learning there is to move fast from a situation like this, even if you're successful, and we were successful, is to move when you don't feel like you have the power to change things a little bit. So I moved actually to MedImmune, and that move is really important. And I want to tell you why this is important. I had a choice to go between either to go to another company. If you pay attention to the titles, by the time I was at Chiron, I was called the vice president at that time. And I had two opportunities. One, to become president of R&D. So it's pretty lofty title, and it's pretty, it's the normal progression in your career. The other one was to be a vice president of translational science in MedImmune. Anybody I was asking, you know, and you really don't know the titles at that time and this and that. Anybody I ask, should I take the president of R&D in a small company or the vice president of translational, which is a lateral move, would have been a lateral move compared to Chiron. And everybody said, of course you're going to take the president of R&D in this small company doing oncology, which was my background. And I had a great mentor, so the person who actually hired me into Chiron. And I called him and I said, okay, he had retired. He hired me and then retired. And until today, he is a great mentor. I called him and I said, I have a dilemma. I have these two jobs and I don't know which one. And my heart is telling me one thing, my head is telling me something else. And this is a lesson I'm sharing with you because I want you to really think about that when you think about your journey and your career and where you want to go. He basically said, don't tell me the names of the companies, don't tell me the titles or anything. Tell me what you will be, what interested you in these two companies and what you will be doing. And when I finished, he basically said, take MedImmune, which was the lateral move. And he said, when you talked about that, there was passion in your voice. You were absolutely, you know, the interest and everything. So the bottom line is, you know, the titles really don't matter. And what was the difference? The difference is in MedImmune, I was gonna learn a lot more. I was for the first time going, not only doing oncology, but it was autoimmunity and also, and really getting into the whole biologics at that time. So that's what intrigued me, and I could, at that time, I felt very comfortable in oncology. I knew my way around, but I was gonna learn something, and that's where my heart was, right? So titles and everything, especially if you are in a company, don't focus on that. When you're going for your career, don't focus on titles. Titles don't mean anything because every company can have, you know, scientist these and seniors these and whatever. And that's really the learning was always now with me. I've never, up until today, had a career development plan. When you go into these institutions, usually they want to have a career development and everything, but I have one guiding post, is my heart. I follow my heart. If I know I'm going to do something that I love, I know I'm going to be good at it. And that's really for all of us when we are passionate about something. So focus on that. This is my advice to you, especially if you go into the industry, you really, or academia, everywhere. Look at the content of the job and what you're going to be learning, because every job is about that. And I have to tell you, MedImmune, I learned so much, and it was the best decision I made. Stayed there for 13 years. And I told you at the very beginning, you know, it was the dilemma. Should I thought, because this is how everybody tells you the world is, you know, do I have to abandon science? Now I'm getting into more management, you know, I don't. And I decided, you know, at some point you decide you have to, you can make that change yourself. You can be the one making the change. So the change I wanted to make is in MedImmune is to actually say, I would never just be a manager. I would never just be a director of this or whatever. Science is why we're here. Science is what drives us, and really put it in the culture of the company that basically we need to publish. There is no excuse because we're in a company that we should not publish. Science is about peer review, and that's what we've done. I think I'm proud to say that leaving MedImmune, we had just last year 19 or so papers in high impact journals, this Nature's and the Science and all the stuff. And at the same time, we developed 5 medicines that are helping patients from 2007 or 8 to 2018. So it is possible if you put a challenge on yourself and really drive, but what you believe in, which is the science, and in this case, in my case, was to help patients, it's possible. So what I'm telling you, everything is possible, but you have to believe that the power of you transforming things and actually also being the next generation that is going to really continue not only the science and the innovation, but also get us into a whole different things that we don't even see today. So so that was MedImmune and really the learning from MedImmune. But was one thing all of you got into science for one single thing is I absolutely believe it is, and what we love about it is learning, right? So don't stop learning ever. So get into positions where you don't know everything and you're gonna learn more. So MedImmune got me to really open my mind that apply the learning from oncology into other therapeutic areas, learn more about infectious disease, about everything else, but also about this class of drugs, the biologics. And after a success like this, so I'm proud. It's never just you, and this is another learning. It's about the team that you develop, the people you work with, because I say it, the minute you leave the lab, you're only as good as the people you have and the people you work with in your team, and never forget that it's never just you at that point. It's everybody else. So, and I could have been really comfortable, especially MedImmune was bought by AstraZeneca, very big company. I was already, so MedImmune is has a very good reputation in the industry. AstraZeneca, you can get really comfortable in a company, and you can get comfortable wherever you are. And I didn't want to get that comfortable. And so I decided then, so here I talked to you about this one, about the culture in MedImmune. But I really, I'm very proud of what we have accomplished, but I didn't want to, I wanted to learn more, and I wanted to do more, before I can call it quit, if you will. I'm not that old, by the way. But I thought, okay, I need another challenge, and I need, I was starting to feel comfortable. So then I moved to Immunocore. And now my challenge is really to be a chief executive of a company and do it again with still doing science. And absolutely, that's my passion, and never forget that. That's first is the science. But really here is, again, the science that drove me into this organization. If you think about, this is a 500, 400 people. It's not the 3,000 to whatever that I had. It's not public. It's a pre-IPO and things like that. But really the challenge was to learn what I'm going to learn here. All these, with the investors and the finance, community and all the stuff, which I had, but not to this extent. But also, I think to really get into a very, very exciting platform, very exciting, solution, as I saw it, for some of the immunotherapy. The immunotherapy in oncology and the power of the immune system to attack cancer showed us that it's possible now to attack cancer, but I want to have not just the 10% to 30% of the patients that are responding, how can we get everybody to respond and hopefully make cancer more of a chronic disease than a killer, if you will. And I looked around and it was really about the science. What's the other platform that can be the next one on the T cells, this one, and so that's my new challenge. Now it's really to get Immunocore successful and get that, what I believe, extending that learning into helping more patients with cancer. So this was just to tell you some of the learning. Hopefully, as I was going, I shared with you some of the learning, and will be more than happy to tell you more about that. But as I was going, there was a lot of things that I knew I would not compromise on. One is the science, one is diversity, which I think is really, really important, not because it's nice to have or because we need to be politically correct or anything. I think is at the essence of us doing science. If you are surrounded by people who think like you're not going to advance as much as if you are surrounded by people who think differently and challenge each other. Otherwise, you can imagine if we were not to challenge in science, I do believe that we were still, believing that the earth is flat and we are looking for the edge of the earth. So I just want you to take that with you wherever you are, that you look at the environment you're going in and question, is it a good environment for your innovation? And I want to move now to the next aspect, which it really fascinates me. There are a lot of things that we are, still challenging in science and in medicines and what we're doing and where the innovation is going. But I think sitting where you are sitting today, you have, I believe, a huge opportunity. Huge opportunity because it's not like what I was thinking, should I be in academia or should I be in an industry? It's more, how big is the ecosystem where you can work? And that's basically thanks to the innovation that's happening all around, that I believe, and I hope I convince you at the end of these, that the ecosystem is much, much bigger than just, a biotech or a pharma, and the academia is a lot bigger than that. Innovation is everywhere. Innovation in why it's important, and I feel privileged to be part, at least, or be in this, in the kind of work that we do, in the science, in what we learn. If you think about, even when you are a PhD or postdoc, or we're paid to have an idea, to go try and come back. How many professions you can have that really on, except if you're an artist. But innovation is important, and we need to continue for all these reasons that I'm putting in this slide, and more than happy to share with you the slides. But basically, that's really what's the exciting. And why I say in this era, you are in an exciting era. You are, you're going to be the generation that takes us even into another level, is because, there's absolutely disruption happened everywhere. Disruption happened in your little small, it started with your iPhones, and imagine what we do all with this iPhone. That was not even possible, was not even imaginable a few years ago, that we will have one little instrument. We basically almost have our lives in there. But that's the disruption that happened. But disruption is all around us. You look at the Ubers of the world, the Airbnb, but that's the era where you are, growing, I would say. And that disruption, when you think about the endless opportunities, everywhere, the advance in technology and advance in everything we do. If you think about, it's really mind-boggling when you think about in 1900, the human knowledge doubled every 100 years. Today, thanks to the technology, human knowledge is doubling every 12 months. So if you think just something like the Internet of Things, there's a prediction that it will lead doubling of knowledge every 12 hours. That's what we're looking at, right? So then how can you, in that kind of technology and era, what can you do? We used to just look at the power of the connectivity that we have and what the information, and you can agree with me, sometimes is overwhelming, but look at that power, what you can do with it. We think about smart homes, smart cities, smart world. That's where we're going to be. Is that the world you're going to be navigating, and you are navigating today as well? So how does it apply into the healthcare? So when you look at this disruption everywhere, you look at this, advancement, I would say maybe a good thing, maybe a bad thing. The healthcare industry, while you see some of the disruption, it is by far, the healthcare industry is one that has not been disrupted as much yet. We are still, there are some really interesting things happening, smart pills and other things, but not to the same extent. But you can feel it bubbling. It's going to happen. And so when you are thinking about what's next for me, think about being the disruptor there, right? So we grew up, me included, accepting that we can take 10 years from discovering a molecule to actually bringing it into a drug. We should not accept that, right? We should not accept that. With everything that's happening with the technology, we should be looking at how can we disrupt things, because in this industry we always hide behind the fact that we are highly regulated. That's really one thing of saying, well, we're not going to disrupt, we're going to continue to be comfortable. But that's an area that you should be looking at if you are interested in going to companies. Think with, you're the generation that can really disrupt some archaic stuff and ways we do things that now we have to do differently, we have to do better, and we have to bring not only smart pills, but all connected all to the lifestyle and other things, because we know it's not enough to just take a pill. You have to change all other things. But I'm just trying to open your mind what it means, and what you could do without accepting what's happening today, or what's already how things are done today. You can be the disruptor wherever you go, because you are the generation who can do that. There is disruption, I call it, at the disease level. When we think about the excitement, no matter where you are, frankly, in academia or in a company, when you think about the technologies, everything that I talk to you about, how you can apply it to attack cancer more. I talk to you, this is passion of mine, the whole immunotherapy and cancer, but it's happening in every single disease, and how the fundamental understanding of the disease. So if you go to the next one, beyond the disease is we are now, it's possible to print organs and do other things. So that just tells you that opens up again what we can do. But there is still a lot to be done, right? With all the advancement, there is a lot of to be done. There is still a lot more to understand in Alzheimer, in others, and get even diabetes, to get it under control, which it's challenging. But imagine all these technologies and what you can do. And so I put all these for you, and why I connected to the ecosystem being much bigger than just healthcare companies and academia and things like that, is to really achieve this disruption and to achieve this a modern way, either in academia or in the companies. There is an intersection between high tech and biotech. And that's what I mean by enlarging the ecosystem. There is a lot more, to be, to work and to be together with the people who make the wearables, the technology and others. So when you're thinking of the universe, where you want to go, explore everything, explore things that you don't believe. Well, I don't know anything about wearables, but scientists are needed there as well, extremely needed. So that's what I mean is the people we have, if we're going to modernize either the drug development or really looking at science in a very different way, we're going to have to collaborate with and work with industries we have not so much worked with before. The Googles of the world, you see them going into the healthcare because they have the power of getting all that information that's showing them, interrogating some things that are just by looking at that information, detecting cancer very, very early. How can we get into prevention and others? Technology will get us there. So I hope that before I finish, just to convince you that the future is in your hands. And I absolutely believe that your generation is really sometimes you will feel like it's challenging and everything, but look at the other half, the cup half full, that you are in such amazing era of technology and possibilities and everything, but also believe that you're the ones who can shape it, right? So it's not somebody else who will shape it for you. This is one of my I always worry about that. You come into a company, and because I've done these things for 10 years or 20 years, you come with ideas. I always say to people, be careful. Don't kill an idea just because you'll say, we've done it, we've seen it. I am always counting on the new generation to come up and challenge us and challenge our thinking. That's how you should see your role going into this world, and that you're ready to go into. So that's really my challenge to you. So as I said, the future is in your hand, and it's really up to you to take it. And it's scary sometimes, and you're gonna, fail sometimes. But what's really important is to stand up, learn from the failures, then they're not failures anymore, and continue. And what you can do, be resilient. I think that's really the key. So thank you for listening, and I hope it opened your mind a little bit from my perspective, and let's have some dialogue now. Thank you.
Okay, thank you so much. I am going to read the first question. Can you still hear me well? Okay.
Yes, very well.
Great. So the first question is how to be on the wheels, meaning how to move forward in your career goals despite personal challenges, such as taking care of a medical need of a family member. Is it okay to get out of track for the loved one?
It's a very personal question, right? I think you have to it's the environment where you will be. I think you have to make decisions. Again, I always say, and it's maybe cliche, but I really believe it. I had all the challenges of the world. That's not stuff I talked about. I was the first, in the first generation of women in my family, and to go to college all together, being all that. But I think I have 2 kids and my family, and juggling all that as I was going into this. And last year, as I was leaving MedImmune and starting the new job, my daughter almost died. And it's not an easy thing to do, right? But for me is you have to, and she became for 3-4 months my priority, and that was really important for me. Obviously, you have to really see your priority you can do, and be in the environment where it's okay, right? So with anything today is really do your research the same way we do our research wherever you go, is look at the environment you're in, because not all companies are created equal, not all academia is created equal, and you have to be in the right environment where you can be yourself, where you can, you know, but get your priorities straight, and you know, you'll find the place that is okay, that you took time, for instance, for what you need to do.
Thank you. Next question, what's one thing you're learning about yourself right now?
I'm learning that you know, I don't know. I don't know if I stop and learn about myself, but what I learned about myself, you know, here's the learning right now, which I'm really enjoying very much, that a scientist can learn anything. So don't let anyone tell you, you know, they will intimidate you that, oh, we don't have the financial or whatever. After 2 months talking to bankers, I completely have the lingo down. I know exactly, and I can absolutely hold my own. So that just, again, and it's really great for you to know our learning of, you know, questioning things, having hypotheses, then doing things, you know, the way scientists think. We can learn anything, right? We can learn anything. Put that in your mind. So when you go and you're thinking scared, oh my God, and I was really with the first bankers or whatever, don't be afraid, because that analytical mind that you know really is characteristic of a scientist, you can learn anything. So if you came that far in your career, you can learn anything.
Wonderful. Next question. How do you deal with a work environment that you love what you do, but you feel stifled by your supervisor? How can you find creative freedom under these circumstances?
Yeah, it's a really interesting question, because what I didn't, you know, talk about is along the way I had fantastic supervisor and I had really terrible ones as well. And it depends on the circumstance, right? So I told you that in Chiron, I could not see myself changing that environment. It was too much. I was spending the whole day once a week, 1 day a week, and sometimes 2 days a week, sitting with people I didn't really care for, I didn't respect, and there was sexist jokes and all the stuff. I spare you and I was doing great science and great things with my group, but that was not enough for me, because that balance was not good enough, right? So I was spending 1 day a week that was too much. So I decided to leave, and I'm so glad I did. I didn't stay, you know, try to change things. But in other circumstances, you know, where I had a terrible boss who absolutely did nothing, it was a great opportunity for me, because what I did is, you know, you widen your network within the company, and you take that. So it really depends on if you feel you absolutely have no other ways, always, you know, there are all other opportunities out there, right? Or don't just feel, this is why connections are really important. You know, talking to people are very, very important, that you're not always dependent on one single person.
Great. Okay, next question. What hiring practices have you adopted to encourage a 50-50 gender ratio?
Yeah, I actually never. So two things. You know, one is I never put quotas, and I never put in our goals or anything, you know, that we need to hire 50% women or something like that. But there are two things that I did that were really important to me. One is, you know, obviously in the hiring, I was involved, especially at the top of the organization, from director and up, I was involved. And the important thing is working with the recruiters. We always asked for a diverse slate. and a diverse from anything, so just from all aspects. But it's really, as you think about diversity, I think there are two things, for me that's really important, is more important than diversity is the inclusion, is you work on the environment that people feel that they're allowed to be themselves in that environment, and automatically you'll get the diversity. It's only, I was at Medi for 13 years. It's only last year that I asked HR to ask, what's our numbers, and of course it felt very diverse, and we were actually 50-50 and 10% African Americans and 49% non-white and stuff. It was never by design. It was by design, but in focusing on inclusion.
Very good. Okay, we have two related questions. Have you felt imposter syndrome and or experienced a time where you felt like you failed, and how did you bounce back from that?
Yeah. Oh, so many times I felt like I failed. Okay, so many times. So if you think you're not gonna go through that, then you're not gonna learn. But I can guarantee you that whenever I failed, I stood up, as I call it, dust off and started again. But the most important thing, you might not see it at that point, what was positive about that. Always look for that positive. What did you learn? What's the learning? I think it's really, really important. And I have to say, especially in our line of work, what we do, if you don't fail, it means you're not innovating enough. I was saying that always at MedImmune. If we are not failing, we are not innovating enough. You're not taking chances. You're being too cautious. So, and what was the first one? Sorry,
Experiencing imposter syndrome.
Oh yeah, that's yes, of course, because every time you're thinking, they're gonna find out I'm not really CEO material or something like that. I didn't feel it this time. I really didn't, because I think that's the experience and the times, but definitely going into MedImmune and thinking, oh, I'm gonna now be in charge of therapeutic areas that I had known nothing about, right? But very quickly, I think this is the formula that really get me to be comfortable, was with my mentor, is to always say, when I said follow your heart, but always seek that you're gonna bring something, but you're gonna learn something. And I think this is when you make that switch, that it's okay. You can be actually saying in your interview, I want to learn this. I don't know how to do that, but that's why I'm coming to this job, because I love to learn. But here is what I can bring to you as well, right? So now I actually advise people and mentor them for not letting that imposter syndrome stop you. That's the most important thing. We all have the same kind of feelings, but they become too negative when they stop you in your track. Acknowledge them and then continue, right? And do something about it.
Thank you. Okay, a question on postdocing in industry. What are the pros and cons of that? And industry positions often require work experience. How can scientists from academia meet that requirement to transition to industry?
Yeah, so these are really very good questions. One is, if you're going to do a postdoc in the industry, I very, very, very strongly advise that there are maybe 2 companies that I could, or mostly 1, that I could hire postdocs from, and that's Genentech, because they have a very rigorous postdoc program, and they don't hire their postdocs mostly they don't hire postdocs, and we were trying to put the same in MedImmune. So you really have to be in a company where you can publish, and you're going to have the same. It's not, don't use the postdoc to just have an into the company, because then you're closing the choices you can have, because any great company will still look for what you have done in your postdoc. And there are some companies where you come as a postdoc, and then you're just really used as to work on the drug stuff and not publish and everything. I never hire those people. So my advice to you is, as hard as it is, unless you have to choose very wisely where to go. And there are not a lot of companies where the postdoc program is rigorous. So you really have to ask the questions. Do they have a real postdoc program and things like that? So don't get intimidated. I think at least, first of all, the industry, not all the companies are created equal. So do your homework. And your homework is by asking other people who you know and other things, and how the science is, what you want to do and things like that. So not all companies are the same. So do your homework and do it really well before you go somewhere. Don't get intimidated. We'll put, you have to have this and that, but a good company looks at your which lab you come from, which publications you have, and things like that. A lot of the jobs, even when you are not from academia, a lot of jobs will say 10 years of experience, but if you come with 5 years and you have really good credentials, so just apply and get your foot in the door.
Great. Okay, this is our last question, and going back to the topic of diversity and hiring and expanding your diversity in your workplace, what are some of the challenges that you faced, and how did you overcome those?
Yeah, I don't think we have enough time that I can tell you the challenges. I was coming back and I said I had the first sexist actually encounter with the banker. I was very surprised because I've been CEO now for 3 months, and I've been meeting with all the investors and bankers and everything, and my first sexist remark I had last week. So my point to you is, you'll have it all the time. It's just how you develop the spine to not let it stop you and be in the environment. So for me, that becomes really important. In the environment that I create has to have that inclusion piece. But no, I encounter that all the time, because I most of the time, 99% of the time, I was the only woman, the only head of blah blah, in a C-suite. But you develop. This is where you talk, you get the mentoring, you do whatever, and you develop how to answer to some things and how to not let it stop you.
Okay, wonderful. Well, I think we've been able to have you answer all the questions, and we really, really appreciate this. It feels like you have been here. And the audience has been extremely attentive, and I can tell that this has been a great time.
Thank you very much.
You are welcome. They're going to give a few remarks at the podium. Thank you.
I just wanted to add my thanks to Christie's. Thank you so much for the heroic WebEx. I know it's an incredible time difference between here and the UK. And again, if you guys would please join me one more time in thanking our keynote today.